Hi, everyone. My name is Beth Johnston. For those of you who don't know me, I'm the Chief Community Engagement Officer here at the FSHD Society. And together here with June Kinoshita, our Director of Research and Patient Engagement, we'd just like to welcome you back to our FSHD University Educational Webinar Series. And just quickly, for those of you who don't know us, the FSHD Society is the world's largest research-focused patient advocacy organization based solely on FSHD. That is a mouthful. We have 33 chapters across the US and now in Canada, and we are part of a 20-country World FSHD Alliance. And our mission is to find treatments and a cure for FSHD while empowering our families. We host these and so many other events to give you, all of our families, an arsenal of knowledge so that you can be your own best advocate when it comes to your care. And we want to empower you to better understand research and the role that you can play in accelerating therapy development. So today, from our physical health and research departments, we welcome Dr. Nikia Stinson. She's from the Center for Genetic Muscle Disorders. And she's going to talk a little bit about dynamic sitting and exercises that can be done from a seated position to help address some weakness and pain issues that so many of us have brought to our attention. So June, I would love for you if you could just properly introduce Dr. Stinson.
Well, as you said, Dr. Stinson is a physical therapist at Kennedy Krieger Institute's Center for Genetic Muscle Disorders, so which many of you may know is one of the world's leading FSHD research centers. And those of you who have actually volunteered for a study at Kennedy Krieger may know Dr. Stinson, because she is on the team of people who do these assessments of your strength and so on. It has to be done in a very careful, very precise way in order to be able to compare that data across multiple patients and with patients at other clinical trial research network sites. So she's a rare and highly valued member of the FSHD research ecosystem. And we're thrilled to have her here because she has a lot of experience also in the clinical setting, treating patients who have, are experiencing various symptoms of FSHD. Dr. Stinson graduated from Michigan State University with a Bachelor's of Science in Kinesiology and also a Bachelor of Science in Human Science from the University of Michigan, Flint. It's a lot of degrees there. And then she studied physical therapy at the University of Michigan, Flint, where she got her doctorate in physical therapy. She has been at the Kennedy Krieger Institute for more than 11 years. And we are really very fortunate that she's taken an interest in FSHD, and we're really looking forward to this talk today. It's something that many people have asked us about. What can I do if I can't stand safely, if I'm in a wheelchair? There must be exercises that will help me. And so that's the topic today, dynamic sitting. So I'm going to turn it over to you now, Dr. Stinson.
Thank you so much, June and Beth, for the wonderful introduction. I couldn't have said it better myself, so thank you so much. I don't even know if I could have said it myself like that. So good afternoon to everyone, and thank you again for inviting me to speak on dynamic sitting, ways to be active in your chair. So the only just additional thing that I have to put in there is definitely just kind of shouting out the Ravens, because we're here in Baltimore, Maryland, so go Ravens. And then also want to highlight just how much I enjoy working with this population and my kiddos. So, I've been blessed to be able to work in, a few different areas throughout my career. And I truly enjoy my work working in the Center for Genetic Muscle Disorders. And again, my patient population, and the fact that I get to work with both children and adults. So, I definitely get to see both ends of the spectrum. And also just my participation in the FSHD Clinical Trial Network. So shout out to everyone there. All of my colleagues in that network are great. All right, so, I'm sorry, hold on. Let me bring the presentation up. My apologies. And if somebody can just let me know, I'm gonna start here. Just a quick comment in here to let me know that you see it.
Yes, we see it. Nice.
Perfect. Okay. So Basically, so welcome. Today, we are going to talk about essentially why exercise is important. We're going to talk about what the research shows. We're going to talk about the benefits of seated exercise, and most importantly, the practical application of what some of the seated exercises that you can do at home. Okay. So why seated exercise is important. So these are from the Centers for Disease Control and Prevention. So they help with lowering the risk of cardiovascular disease, of hypertension, of lowering the risk of diabetes, type 2 diabetes, of certain types of cancer. They help with cognition and helping to delay cognitive decline, and they help with memory as well. They also help with improving quality of life. They help with reducing anxiety and depression, as we all have a truer understanding of that, and kind of, we've all been through different phases, especially right now with adjusting to our new state of norm with the pandemic. It helps with improving sleep. It also helps with improving for weight loss, and also helping to slow the rate of weight gain. It helps with bone health. It can help with physical function and lowering the risk of falls. And please, at any point in time, if you have questions, we can wait to the end, or if there's something you want to throw out there during the presentation, please don't. Please feel free. All right, so getting into what the research shows. So here are a few articles showing what we've learned so far. So in this study, this is a journal article where they did an MRI study that looked at the effects of an aerobic exercise training program and cognitive behavioral therapy in combination with a physical activity program in the rate of fatty infiltration in thigh muscles in patients with FSHD type 1. They separated the participants into 3 groups. So they had a usual care group, which received no treatment. They had an aerobic exercise group that participated in lower extremity cycling 3 times a week for 30 minutes up to moderate intensity. And they had the cognitive behavioral therapy training group that worked with a cognitive behavioral therapist that worked on just techniques for helping to deal with pain and fatigue, in combination with participation in a physical activity program that consisted of walking or cycling for 2 60-minute sessions, up to 2 60-minute sessions per day. So what they found in this study is, in the aerobic training group and in the cognitive training group, they showed a slowdown in the progression of fatty replacement of muscle tissue, specifically in the adductor magnus muscle group and the vastus medialis, which are both muscles within the thigh group. They also showed in both groups that they had less fat infiltration with increased physical activity. And they also showed an increase in 6-minute walk distance from baseline. And in a related study, they showed a significant reduction in chronic fatigue in patients with FSHD. So knowing that that is one of the predominant symptoms that I do here in our clinic, ways that we can make you more energy efficient throughout the day. So being able to include activity in that, allowing you to have more energy throughout your day. In this next study, this is a popular study that was actually most recently referenced in the webinar Staying Active at Home by Julie Hirschberg. Hopefully I'm pronouncing her last name correctly, out of USC. I truly enjoyed her presentation. So it's wonderful that I can kind of cite this article as well, and it's a great article. So in this study, they looked at the safety and efficacy of a 6-month home-based exercise training program on fitness, the effect on muscle and motor function in 16 FSHD patients. The participants were split into a training group and a control group for the first 24 weeks. The patients that were assigned to the training group participated in leg cycling for 3 times a week for 35 minutes. And then they did a combination of strength and high intensity interval training and moderate intensity aerobic exercise for 24 weeks. After the first 24 weeks, then the control group participated in an identical program that the training group did for an additional 24 weeks. So the results that they saw from this study were a significant improvement in VO2 max in the training group, which looks at fitness. They saw a significant increase in muscle endurance and maximal voluntary contraction of the quadriceps muscle using a fatigue test. They saw increase in both the 6-minute walk test, both within the training group, and they term it the control training group, since the control group did eventually participate in the home program training after that first 24 weeks. They also saw muscle fiber cross-sectional area increase in the training group, which means that, you know, they saw some observed gain in muscle mass during the study period. So that's awesome. Definitely, you know, the more we can see that, that's the goal that we're looking for. They saw a decrease in fatigue in both the training and the control training group, but they did see no changes that were reported in quality of life in either the training group or the control training group. So in this last study, they looked at high intensity interval. They looked to see if high intensity interval training is safe and effective in patients with FSHD type 1, with training taking place over a combined total of a 16-week period. So basically, and what they saw in this study was they found that high intensity training was found to be safe. They showed low fluctuations of creatine kinase level. So for those of you who might not know what that means, so essentially when you have like severe increases, usually that means that muscle damage has occurred. So severe muscle damage has occurred. So the fact that they only saw low fluctuations in this was a good sign. They showed that the activity level was unchanged for patients who participated in HIIT training over that the activity level was unchanged, but patients preferred HIIT training over other modes of exercise during, for this particular study. None of the patients complained of muscle pain, injury, or worsening of self-assessed health. They demonstrated an improvement in fitness with the HIIT training. And although strength and functional assessments, and the functional assessments that they used in this study, looking at the 5-time sit to stand and the 6-minute walk test, were relatively unchanged, the participants did demonstrate an improvement in fitness greater than 10%, or either improvement or unchanged report of self-assessment of function. Okay, so now getting to the benefits of seated exercise. So as you can see here on the PowerPoint here, that you can work on increasing your strength, you can work on improving your flexibility, you can work on improving your ability to perform everyday tasks, for working on improving your balance, for decreasing depression, for working on decreasing body fat, for decreasing arthritic pain, for working on, if you have any issues with postural hypotension, seated exercises work for helping to decrease that. And they also help with decreasing the risk of falls. So in addition, seated exercises can also help with stabilizing the lower spine, for providing a fixed base, which is helpful for those with lordosis, which is also another common characteristic that is seen in FSHD. So just in terms of, if we see me sitting here in a chair, and I should probably switch, probably be easy to see it with a darker background here. So typically we tend to see more of this posture where the back is arched, but having a stable base where you can actually work on doing some working on strengthening of your core muscles to kind of work on the alignment of your spine. So you being seated in the chair, it allows this part to be stabilized and supported so that you can work on doing some postural exercises. It can also help with facilitating greater range of movement by providing points of leverage and support. It can also help with minimizing load-bearing and painful joints. So if you're having, pain in your ankles, so like the fact of, if we're transitioning, you're doing more sitting, and you're having pain in your joints from standing, sitting is a great way to be able to reduce the pressure that's on your joints and still be active and still be able to participate in exercise. And it also increases your confidence with movements you are unable to do in standing. Okay, so now for the fun part, as we begin the workout. So basically with this, you always want to start, you always want to start with the warm up. So that's just basically preparing, excuse me, let me put this up here a little bit, I'm sorry. You preparing your muscles for moving. So with this, you can look at gentle active stretching. You can do some light biking. So if you're using like a floor bike, or if you're using an arm bike, which we will actually go into greater detail here shortly, just doing that for a few minutes. So I usually say at least 5 minutes to warm up your muscles. Now this can be longer. So, you know, sometimes the warm up can be 10 to 15 minutes. I will say it is based on your personal needs. Okay. So if you need longer, you take longer for your warm up. You can do seated yoga exercises. So I know that there was a webinar done a little while ago with showing definitely some yoga exercises that you can perform in a seated position. Those are all great things that you can do for getting yourself warmed up for exercise. So after the warm up, you want to work on actually then beginning to increase your heart rate. So the goal is kind of working up to your target heart rate zone with the goal of achieving moderate intensity. I have included a link in this presentation that you will see later that will take you to a website that will help you to calculate your target heart rate zone. So basically you just have to enter in a little information and it will actually calculate what that range is for you, which I find to be very helpful, especially sometimes when I'm like, okay, math is just not my friend today. This is very helpful in helping me to be able to do it quickly. So kind of going in here when we talk about some examples of aerobic exercise. So again, we talked about cycling, and cycling being one of the main modes. So as you heard me mention in the review of the research, that is what these studies looked at for looking at exercise. All of them were based on a cycling test. Now, this is where we also kind of need to start expanding with research and looking outside of doing cycling tests, but it is a great exercise that can be done in multiple environments. So you can do floor cycling where you're doing it with your legs. You can do arm bike cycling where you're doing it with your arms. Both are great workouts. So I will even tell you for when I do it myself personally, usually when you're doing the arm cycling, your heart rate will increase faster in general than when you are doing the leg bike. So just something to be mindful of and be aware of when you are doing using either the floor bike or the arm bike for exercise. We will also look at the recumbent elliptical, air boxing, which tends to be in the chair dancing, which tends to be favorites of the kiddos and the adults that I work with. So let me bring up a couple of videos. And my disclaimer is I do apologize. These videos were playing in the right direction yesterday, but unfortunately, for some reason, they are playing kind of at an angle today. So I will make sure when they get loaded onto the website for you to view that they play in the right direction for you. So I am going to go ahead and I am going to go over to the next slide here. Okay, so just based off of what we see here with the picture, so this is me using the floor bike. And so basically I did bring the exact bike that is in that picture that I have here as well. So this is one that I commonly get out with my patients, and we will, if we're doing arm cycling, we will put it on the table for them to do. My table is a little short here, but you get the idea. If I prop it and essentially arms go in and you're cycling and you're going that direction, you can go both forwards or you can practice going backwards, and you can always mix it up. So like if you go 1 minute forwards, 1 minute backwards, you can always do that type of workout as well, just to kind of change it up a little bit. So here is me doing floor cycling. And again, I apologize for it playing to the side, so we might just kind of have to a little tilt to see. And so this is a really quick video. I just wanted to be able to demonstrate so that people saw. Hold on, let me play that one more time. That's our next video coming up. And so basically just my foot in the pedals, in the pedals, and just going forwards. We will discuss later, and I will show some options of some different foot pedals. So I know not everyone can utilize those pedals. They can tend to be narrow and being able to keep your foot in place there. So there are a couple of other different options that can be used as well for if you need a little bit more support. All right, so this next video is me doing the arm cycling. And again, we kind of have to tilt our head to look here. And again, just because as I was demonstrating on the table, going in a forwards motion. And so with this one, you know, being able to start off slow. So even if you're doing 10, 15 seconds to start with, and if you have to take a short rest break, or if you can do 30 seconds, a minute, 2 minutes, until you're like, okay, I'm starting to, you know, if you're starting to feel tired, or if you're having some discomfort, okay? And that's when you know when to stop, because we don't want to have you having muscle discomfort or pain. All right, and in the next video, this is me using the recumbent elliptical. So this is our version of that here at Kennedy Krieger. It is the new step. And so as you can see here, I did mock. So this one does not come per se with straps that strap in your feet, but there are bands that that I have around my feet to help hold my leg in position. And then also with the arms as well. That you can have out, so when you're going here support wise, so you can get both an upper body and lower body workout as well. And so here's that video. And again, just a little tilt. Okay, and then the next video should be me doing some boxing. Okay. And so here with the chair boxing, so I am just doing it for visual showing here with the kiddos. What I do is essentially like I'll have anything up target wise for you to hit, even for like my adults. So, you know, it's like play, like we're sparring. So like if we're boxing here and I give them targets to go to, those types of things. And you can even do this if you are someone who enjoys like We Fit, they have a boxing game and it is engaging that you can, you can be seated like on your chair and then you're actually going along with the video. So you can make this more interactive if you would like to. All right, and so this is me doing it. So you can see that I'm going straight forward, and then you can also include in there with some trunk rotation as well. So we're definitely getting that arm and we're getting that core workout in as we're doing the different motions. And then you will see, I did put a link in here for the chair dancing. I say, honestly, you want to do a video, you know, something that engages you and also music that you like. So, you know, there's a ton of those videos on YouTube. Choose the one that best interests you. I'm sorry, give me 1 second. I'm trying to move myself back over now. Okay, so now what we're going to do is we are going to get into some of the strengthening exercises. And so with that, there are going to be where we are using some TheraBands for just doing some light resistance. Here is also, you can do a combination of upper and lower body movements as well. So you're getting strengthening of the arms and legs at the same time. So you're incorporating those different muscle groups together with a coordinated motion. So in this first one, I'm sorry, excuse me, I am doing a modified ski jumping jack. And so with this one, I am using sliders under my feet to help reduce the effects of friction. I'm sorry, excuse me again. To help reduce the effects of friction for those with leg weakness and who can't fully pick up their feet. If you can, then you can absolutely do this without the sliders. And this is, again, for that full body workout. So here is me doing it. And forwards and backwards. And so with this one, I would say, you know, starting slow. So usually with my patients, I will start off to kind of see where we're at. So, you know, for some reason, I just like the number 10. So I usually will start with, okay, let's see if we can do this for 10 seconds. And so the question would be, do we need to go up or to go down? And that's going to be based off of me seeing the patient move and seeing how you're moving. So if I know that whether I do it for a time period or I do it for a number of repetitions. So that will be depending on basically kind of how you starting at, you're determining where that self starting point is. So you're going to kind of start to say, okay, this is what I can do right now. And then you're going to work on building up from there. Okay. So in this next one, I am doing modified jumping jacks. All right. And so with this one, again, I am just bringing my arms up so comfortable. So you do not have to bring your arms up as high as I have mine. So even if you kept your arms down lower, which I'm gonna bring my screen over here. I'm gonna do that. Hopefully everybody can see me. So even if I don't hear my, I'm sorry, excuse me again. My feet are not on the sliders right now where I'm going out, but even if you just bring your arms out a little bit, that's absolutely fine. And to be completely honest, even if you didn't do the arm component of this, this is still great for you to be able to do with your legs. And you can even do it where you can bring the arms out to the side, and that's fine to do it in this direction as well. So the goal at this point is that you're moving. All right, so in this next one, this is me doing bicep curls. So I don't know if anybody kind of noticed in there that that is my tribute to Golden Girls, because I used to watch that with my grandmother when I was a kiddo, and it still is one of my favorite shows. So here I am using a red TheraBand. So like I was saying, in terms of the bands that you can use, generally the lighter the color, the less resistance it has. So again, start light, okay? And then you can always work your way up, okay? So the goal is that you just don't want to overtax yourself. So here is me performing the bicep curl. And for me, I have this, I'm stabilizing it with the bottom half under my foot as I am doing the bicep curl. This could just as easily be under your thigh. So you can position it that way as well. So fortunately, again, another tilt. And just with the band, so I did bring down an example of that as well, actually that exact same red TheraBand here. And so I generally will wrap it around my hand to do it that way, to be able to hold it in place. You can, depending on personal preference, to be able to take it. And I always say, when you get it, you can order bands from Amazon online, where it'll come in a roll. So you just want it long enough that you can work with. If you need to, you can always take it to be able to tie a loop, to position it in this way. If it's a little harder for you, if you need to be able to position it that way, and you can do the bicep curl that way, okay? And that also could go the same with, this could be the foot attachment as well. Okay, so in the next slide, you will see my arm is actually positioned on the table. So this one, again, I am doing a bicep curl, but I am doing it, I'm reducing the effects of gravity. So I'm doing it in a gravity lessened position. So now my arm is supported, and essentially I'm going like this. And you're still doing the same motion. So this right here going in this direction will be working the back of my arm. So I'm actually working the tricep muscle. And then as I'm coming forward, this would be working the bicep muscle. And I do actually have a table here. I can do a quick, maybe demonstration on. So if I turn you this direction, and as I'm sitting up to here, so does it necessarily have to be at like shoulder height level when you're doing here? No. So this can be a comfortable table as long as your arm is supported on that table, okay? So again, this would be me working here, triceps as I'm extending my arm out, making it long, biceps as I'm bringing it in, making it short, okay? And you can even add a little bit of resistance with this. So I always tell people, if this is very easy for you, but then lifting your arm up like this is hard, you can also just try. So I have a bottle of water, and you can even do the smaller bottle of water. And essentially where you're working on going out, and then you're coming in, out, going in. All right, so in our next one, we're gonna look at some gentle core strengthening exercises. My apologies, I'm trying to keep up here and I'm having to move the, my screen here. I put down here at the bottom, basically you always want to, when doing these exercises, you want to start with a gentle engagement of your core muscles or your abdominals with bringing your belly button towards your spine. So in that previous webinar that I was referencing before with Julie, she had talked about just being able to engage in, basically she had like a foam roller behind her back. That was kind of great to be able to say like I'm pressing into, but you really want to think about, here's my belly button right here and my other hand is just kind of where my back is. You can use a chair. You want to think about just kind of gently drawing your belly button in towards your spine, and what you're doing is you're kind of tightening, but you're rounding out your back a little bit as well. So if you see me here going in like that, and it's just me tightening up my abdominal muscles and kind of getting myself set for participation in these exercises. Okay. And you should be, whenever you do that, it shouldn't be like you're sucking your stomach in and you're holding your breath. You should be able to breathe when you do that exercise. And for some people, that in and of itself might be a little challenging to do. So this is where you would start. Can you hold it for a count of 3? So, 1, 1,000, 2, 1,000, 3, 1,000, whether you count out like that, you use a watch, however you want to time yourself. Okay. All right. So the first exercise that you will see here is basically I am sitting on a lovely little disc. And I highly recommend this. And actually my kiddos and my patients like this, my adults and my kiddos like this. It's called a balance disc. Again, this can be purchased off Amazon, and I'm pretty sure this one was purchased off of Amazon. I'm going to just put my screen down here a little bit forward. I'm going to put my screen down here a little bit that you can sit in. So I will say whether a chair that, just because it's easier for you to see, I'm going to do it in a chair that doesn't have arms. You can do this if you're in a power wheelchair, a scooter, you can do this as long as the seat is a firm surface. I always say for people, when you start off with this, I recommend that you do start with something that has armrests. That way, if you feel a little off balance, you have those armrests that you can kind of grab onto to correct yourself. Okay. And so with this, you will see that all I am doing is I am essentially just kind of sitting here. So one, just even sitting on it, because I'm balancing myself to kind of stay in the center. It's a gentle movement, but my muscles have to engage in order for me to do that. And I've already kind of set myself. So I've already brought my belly button in towards my spine. I'll try to bring you up just a teeny bit here. So I've already brought my belly button in towards my spine as I'm working on just keeping myself centered in the chair. Okay. Now this can be increased with you doing where you're being a little bit more active with it. So I'm sorry, let me play that first video. You will see that I am doing pelvic circles. And so with that, essentially in the video, I am doing kind of going side to side. So I always kind of going whether clockwise, counterclockwise. So if I wanted to go clockwise, I would be going to 3 o'clock, 6 o'clock, 9 o'clock, 12 o'clock. And they're just gentle movements, and I'm going through that full range as I do it. And then, whether you do 5 repetitions that way, and then you work on doing the reverse direction. So I'm engaging my abdominal muscles, my back muscles, pelvic muscles as I am doing this. Okay. Now, the next one that you will see here is me seated on I'm not sitting on the disc, but I'm basically sitting flat in the chair, and I'm working on reaching forward. And so with this one, the big thing here is that you are, again, doing that you're doing that activation of your core. So you're bringing your belly button in towards your spine, and then you are working on rolling out the ball. So playing that video for you. So again, kind of getting that tilt. And as you see here, I have both hands on the ball and I am rolling forward, okay? So I'm engaging as I am shifting my weight forward, and then I'm having to bring myself back, okay? So engaging my abdominal muscles, back muscles for controlling as I am doing this movement. And the next one. So in the next one, I am using a smaller ball which I did bring with me, but I can't find. But anyway, have the video here. So this one is an example of where you have one hand on it. So I'll kind of demonstrate here with the smaller ball. And I'm literally, you can have your hand in your lap if you need it for a little bit of support, but I have my hand here to kind of take away that support, and you're working on reaching forward. So this is where you're doing one hand movement, whereas in the other one, you were having both hands on the ball and working on reaching forward and working on coming back. Hold on one second. I got a little ahead of myself. Okay, here we go. Trying to move myself out of the way because how this is coming up for me. All right. So in this next one, we are looking at trunk rotation. Okay. And so, oh, did that play? There we go. So basically with that, you're basically just working on going to your end range, okay? And so here, I'm just literally, I have my arms here. So again, for people, like if you can go up higher, by all means, go ahead and put your hands up here and you can do the rotation and just holding for like, you know, a count of 2. And then coming here. So it's good for just a good stretch as well, but you're also working your obliques in this direction as well too. You can even make it a little bit more challenging if you want to have something small weighted. So even if I wanted to take this ball to kind of give me just a little bit of light resistance, I can hold on to it, take it, and I can turn that direction, and then I can come back. I can also increase the challenge of this exercise if I want to do it sitting on this disc, because now I have an unstable surface that I'm sitting on. And so my muscles have to activate a little bit more, basically, as I'm keeping myself balanced on this disc and doing an active motion with rotating my trunk. Okay, and so what I did not put in here, but I will make sure that is included in the other in the presentation. So you can always do when we talked about lower extremity strengthening, just even with doing marches. There we go. Where you're just doing marches. So even being able to lift up the leg here, where you're going up and you're going down, or you can use the sliders as I showed in the video. And essentially on my feet here, lower this down so you can maybe see me a little bit better. Hopefully you can see my feet. So I have it on the side for tile floor, and I'm going here. And so this could be essentially, again, kind of, I showed it with the jumping jacks, but even if you're just moving the foot in this direction as well. So kind of where we think about doing a kick out, you're going here. So this is just, you're not lifting your leg up against gravity, but you are still activating your quad as you kick out. And as you bring back, you are activating your hamstrings, okay? You get a greater range of motion when bringing the leg back if you scoot yourself up in your seat a little bit, okay? The challenge, again, can increase if I'm sitting on this disc and then I am doing the exercise. So now I have to work on stabilizing myself as I bring my foot out and then as I bring my leg back. Okay, so now we're gonna move on to some commonly asked stretches that people ask me about, just in terms of how can I do these seated in my chair. And so basically with that, we're gonna look at hamstring stretch. And so with this one, as you can see, the leg that is extended, that you see out straight, is the one that I'm stretching. I am leaning forward, positioned on the chair. So if you need some anterior support, so there are some, whether you can do it with just having, let's go back again. Hopefully. lower body. So whether you can do it without support and you're just reaching down and you're going towards your toes, and I'm stretching my right leg and I'm reaching down with my right hand, and my left leg is just supported on my left thigh, giving me a little support, so I'm kind of just resting on there. Or as you saw in the chair, you can have a chair in front of you, whether like I have it, or you can turn around the other way as you're stretching the leg to give you a little bit of support in that direction. And again, with your stretches, I always usually recommend 30 seconds, as long as you can tolerate it, and then repeating it 3 times on each side. All right, gastric stretch, another commonly requested stretch. And so with this one, you are basically just positioning your foot. So I have it up to the bench that we have in our therapy gym, but you can do this to a wall. I have patients who use their power chair. So they just find a wall or a stair that they can kind of position, and they like slowly inch. So with this one, when you're putting yourself in position, take your time with doing it, okay? You don't want to just ram your foot into the wall or a stair or anything like that. And again, you're getting yourself up. So kind of as you see, my heel is flat against that bench. So for some people who have a lot of tightness, you may not get flat against the surface, but you just try to get as best you can, because you're likely gonna feel a stretch once you get your foot up close. And the goal is also having the knee as straight as you can. And then the last one that I'm going to discuss, at least right now, is going to be the chest stretch. And so with this one, just because, again, another high area of tightness can also be the pecs, okay? So typically where I will see, easier to show from this direction, where the posture may be like this. And so we're having some tightness of these muscles here. In the picture I show where you can work on stretching out the chest. So I'm just kind of putting my hand out here, but as the picture shows, you can just position your hand against the back of a chair, and you're basically just kind of turning your body away so that you feel a stretch through here. Again, same thing, I say 30 seconds. Sometimes this one can be a little bit more sensitive. So I do have people that I recommend, like, you start off with 10 to 15 seconds and you work your way up, okay? All right. So in this next slide, this is just an example of heart rate zones. So depending on the source that you look at or that you see, these ranges can change a little bit. So at the end of the day, the big thing is that you're going to start slow and you're going to work your way up. Okay. So in this particular chart, they are rating easy between 50 and 60% of your heart rate reserve. Then you're also looking at the next category, moderate, at 60 to 80%. And then high is 80 to 90%. So these are just a little bit higher than I usually rate them. So generally I would say, the 50% to like 65%, I'm kind of still calling within moderate range. So, but at the end of the day, it is going to be dependent on how you are tolerating the activity. Okay, so you always want to remember exercise safety whenever you are working out, okay? So you never want to overdo it. Let me stress that again. You never want to overdo it. You always want to start slow with exercise and activities, especially if you are just beginning them and are not familiar with doing them or have not done them in a while. You want to work your way up, okay? Using heart rate zone for your target heart rate range, I think, is a great way of kind of saying, okay, especially for those people who identify with numbers and they need numbers to be like, okay, I should be here and I should be between this number and that number. So I think the target heart rate zone is great. And it's a way for you to be able, as you're tracking. So the other scale that they use is, people might commonly know as the Borg, or the rate of perceived exertion. So in general, just for general reference, when they talk about moderate intensity, if you're doing an activity, just like I am talking to you, you should be able to talk and to say a sentence and to be able to speak to me. If you're doing that, that means you're working too hard, okay? And you have definitely gone into that high intensity, okay? And you need to take a break, and you need to come back down. All right. Also, you want to make sure proper tolerance of exercise. So again, exercise should be pain-free, okay? The goal is not that we're breaking down muscle, okay? We want to be optimizing and maximizing your strength and your function. And then again, if you feel fatigue or muscle burn during the exercise, stop and take a break, okay? And then after you take a break, if you can go back to it and you're feeling okay, continue with it. If you are continuing to have that burning feel and that fatigue feeling, then that means that you need to, you may need to bring it down a little bit or adjust the exercise. Okay, so another thing that people commonly, you know, just questions to ask that I see in clinic, what about the equipment? So, you know, it's great when you have, you know, clinic equipment that's there, but then when we get home, you know, having equipment that's accessible to us and also affordable. So, and understanding, you know, on both fronts with that. So the Velcro strap. Basically, as you see, so you saw it when I was in the recumbent elliptical. That I had a strap around my foot. This is a larger strap. So this one you would probably look at, you could use around your thigh. So if you were doing the floor bike and say you had a little bit more challenging to be able, I think that looks good. Okay. So it's a little bit more challenging in terms of being able to keep your legs in line. So in line with your hips, you could put a strap around. So if I'm demonstrating with this TheraBand right here, where I'm positioning around my legs, like so, to help hold me in place while I'm on the bike. And I'll just quickly pull this one out. So as I put my foot here in the pedals to help keep me in line. Now, the thing about that Velcro strap that's in the picture, which I'm sorry, you can't really see all of me, but basically the band is helping to keep my legs into place as I'm cycling. That strap comes in various different lengths. So you can get one that can go around your thigh, and then they also have ones that are smaller that can go around your feet. All right, light resistance bands. We pretty much talked about that. So what you saw me using for the bicep curl. And again, this is a gentleman doing a bicep curl. The balance disc that you saw me sitting on. Matter of fact, the exact balance disc you saw me sitting on. The floor slider. So that is, and I actually use these in the gym with my workouts. I literally got this, mine are called 360 Flow. I got these from like either Burlington or Ross, and I spent less than $5. But you can also order them on Amazon as well. And the beautiful thing about if you get the ones that are like for exercise, they have the two sides. So this side right here being for like tile or like wood floors, because that's what I have in my house. And then the other side being for sliding on carpet. I do know that I do have some people who have just gone to like Home Depot and you can buy like the furniture sliders. And you know, they'll tell you whether they're for wood floors or whether it's for carpet, and you would get it for the surface that you need it for. Okay. Some additional equipment would be the QB. So this right here would fall under like the seated elliptical. So kind of where you have that motion where you're going like this. So it kind of looks like a stepping motion this way versus a biking motion this way. So this, again, you can kind of adapt based off of, one, it does have some assistance support. So to kind of help you with doing the motion if you need some support. And you can always just get those straps to place over your feet to help keep you in pedals, okay? For people who wear AFOs, again, because it kind of has that little lip that's right there, your shoe, I would think you should be okay with maintaining your foot on there as long as you had the strap to help hold your foot in, to help hold your feet as well. This is just another example. So this is like under the desk, and just basically with the difference between these two, they're pretty much equivalent. You can see that you can have that anti-slip mat that you can put up under there. One is just a little bit more expensive than the other. So generally the more expensive ones have a few more features, but they're still reasonable in comparison to using like the recumbent elliptical that you saw me demonstrating. All right, and then I just basically did have to put on there like an example of the recumbent elliptical. It is a great device. I know people enjoy it. You can get the seat. So the seat actually does turn so that if you want to transfer into it, you could, to do like a lateral transfer into the seat. I do understand that these are definitely more costly devices. And the one that was actually featured on the webinar, I'm not exactly sure when the gentleman, he made a post on it. I mean, it looked like a wonderful machine, but I also know that it was quite costly as well. But if it is something that you know you have and you're like, I'm going to use, making the investment towards something like that. All right, and so basically where I was talking about earlier, these are some motor assist bikes. So essentially with this, you can see similar to how the floor bike that I had here, but basically it has a motor that helps to assist, and these have like splints that you can position your feet in. So, you know, where we were talking about getting over the obstacle of a pedal like this, where you have a fully supported, where your lower leg is supported in there and your foot is supported in there, and then they have straps to hold you in place. And then again, if you need something at the thigh, you can always use that Velcro strap that I just showed you that would help hold your legs in, okay? And so this one actually, I have not personally used this model, but I have been looking into it just because it is of the more reasonably priced things that I found on the market. And I wanna say, I don't wanna quote you numbers or anything like that, but it is, I think it's like close to maybe $400. But all you have to do is just copy and paste that name from this presentation, and you can take a look at it. But it does give you, so basically it kind of helps in aiding with the movement, so that if you do have weakness and it's tiring to pedal your legs forward the whole time, that this bike will help you with that, okay? And so here's an example of me doing it. And they're not the same model, so this is a completely different bike, but the concept is the same. And so this is me pedaling, so you can see how my foot is secured in with the strap. My lower leg there is also strapped in. I don't have a band around my legs, but actually, no, I do. It's just black and you can't see it on my blue pants. And that's just helping to hold my legs in position. And I have actually put some of my muscle clinic patients using this bike, and they've enjoyed being able to bike just because it does give them some support and it helps to hold them in position, which they feel like they can use their muscles better. All right, and just a couple more slides. So in this one, this is just an example of the arm bike. So again, this is a little bit more expensive because it's both components with using the arm and the bike, but again, it's motorized, so it does have the motor assist. These are grip assist gloves. So this is more commonly used in spinal cord injury. So where it basically kind of comes around the palm of the hand and like it helps to hold you in position. So that is what those gloves would help you to do. And let me just move this so I can play the video. And then as you can see on the video that I'm doing here, this is probably one of the few that actually play in the right direction, that my arms are going forward and that the bike is just helping to assist me with the movement. Okay. And so here are the helpful links that I was speaking about earlier in the presentation for calculating target heart rate zone. So going to this website, you basically, it just asks you for, your age, and I believe it asks you for your resting heart rate. And so for those who might be unfamiliar with how to calculate your resting heart rate, essentially you're just finding your pulse. So if I'm demonstrating on myself, I'm finding my pulse here. You are counting, so looking at the clock for 30 seconds, and you are counting how many beats you feel in that 30 seconds. You're gonna time that by 2, and that is going to be your resting heart rate. Now, my one disclaimer with that is when you calculate your resting heart rate, just when it says resting, you need to be in a resting position. So not have been doing something with your arms and being active and moving around, just because that's not gonna be truly representative of your resting heart rate, okay? So I would say at least where you've been in a resting position for 10 minutes, and then to be able to calculate your resting heart rate. Okay, and so this other link here is the seated dance video that you can check out at your leisure. All right, and then I just want to give a special thanks to all of the wonderful patients that I continue to learn so much from. So, I mean, I truly learned something from each and every one of you, and I truly appreciate everything. And so, kind of as you teach me more, hopefully I can take that into what we can do to try to help with, again, you know, increasing function, maximizing, and ultimately, as June and Beth were saying, you know, with research, the goal is working towards a cure. All right, and I know I pretty much spoke longer than I actually thought I was going to speak. So any questions, please let me know. I'd be happy to answer what I can.
Hi, yes, thank you so much. Maybe you can stop sharing so we can go back to a gallery view. We have some questions from the audience, so we'll read them out. And first question, someone wanted to know if this will be available. It will be, oh shoot. Yeah, we are recording, good. Phew. I'm not in a panic there, that was ridiculous. Yes, we will post the recording on YouTube. Here's a question from Lynn. She says, I've always been told that once I've lost muscle mass that it couldn't be recovered and it was gone forever. Is that true?
So it's one of the things, like once you atrophy, so the goal at that point is honestly strengthening the muscles, the muscles that you have. So even if it's the muscles around the atrophied muscles, you do want to, you know, the goal is still being able to strengthen those muscles so that it's optimizing your function.
But can't it also happen in FSHD that some muscles may atrophy not because they are degenerating, but because they're underused?
Yes.
So those might be still.
When you're not using your muscles, that you can lose that strength as well. So definitely that's why, you know, just maintaining, like being active, and you're helping to slow that risk or slow the deconditioning process of just not using your muscles at all.
Let's see, question, a comment, I think, from Diane. She said there's a word of warning on the recumbent elliptical. The new step is better than the spirit, she thinks, because the spirit does not have a non-resistant level. I hurt my knees using the spirit and went to the new step, which has a no resistance level. Do you have any?
Okay. Thank you for that.
Okay. Kathy has a question. Does the floor elliptical provide a greater benefit over a floor bike?
So I would say not necessarily does it provide a greater benefit. I think just with the motion, so where it is the motion being more, I guess, back and forth, whereas the floor bike does more of a circular motion. So at that point, I would honestly say patient preference. And even from the patients that I've tried it on, some will say that they like the, essentially, if I'm in comparison to the new step, some will say that they like the new step better, just because of this motion. And it also depends on weakness level in like the muscles involved. So sometimes that can be, you know, in terms of them being able to actively perform the exercise.
This is a kind of related type of question between the motions from a recumbent elliptical versus a recumbent bike with arm bars. Are you basically working the same muscles with those and it's just a matter of preference, or do they actually work different muscles?
So you are essentially working the same muscles, like I said, just kind of the pattern of movement. So when you think about the bike, and even when you think about the new steps, as you're going forward, you are activating your quads and your glutes. And as you're coming back, you're activating those reverse muscles. So where you're going this direction, if you're stepping forward, so it would be, sorry, I know that probably made some people screech. So as I'm going here and I'm demonstrating, this would be a new step motion. And with here, I am activating like my hamstrings as I go up, my hip flexors when I go here. And then as I'm pushing down, my quads and my glutes. But I'm also doing the same thing when I go in a circular motion as well. So it's just a little bit different in terms of the pattern.
Here's a question from Shireen. She has a drop foot, but she is totally mobile. Is there another idea for cardiovascular exercise besides biking?
So what I would say is you could look at, so like this is where I kind of gave the example of like the chair exercises, so different things. So if we're looking for seated options that you can work on doing, this is where anything like where they do kind of like whether it be chair aerobics. If you are a pool person, the water is great. A lot of my patients love the water. So depends on if you're looking different environment or if you're looking for another seated option. And so again, with that, I would say this is where you can kind of get into those different videos that are out there and being able, with moving your arms, moving your legs and doing different movements seated in the chair.
It's a question from Tom. Is it better to go with lighter weights and more repetitions versus a heavier weight and fewer reps?
So I'm going to say my personal preference would be lighter weight and more reps. Like I said, just because I know a lot of people, in terms of saying the high intensity training and wanting the concept of trying to hypertrophy and trying to build muscle. But I definitely think in terms of that, like you can use the lighter TheraBand and you can do more multiple repetitions. And I feel like you're still getting, you're still engaging the muscle. You're still activating the muscle for getting a good workout.
Okay. There's a question. Have you heard any complaints from patients having, say, right elbow pain? Is tendinitis a frequent problem if you have FSHD, or is it just generally a frequent?
So I'm not going to say that. I mean, I do hear some complaints of tendinitis, but it's not something that I say that I hear on a regular basis. So I honestly think it's probably activity dependent in the things that you do. And then also it's going to depend on your pattern of your weakness as well. So what muscle, if they're, for some people, their triceps are weaker than their biceps, and how they're doing certain motions in their functional activities that can be causing that tendinitis. But is that like a common complaint that I hear? It's not a common complaint that I hear.
Oh, thank you. Diane Pappas wanted to share that she uses the pedal assist floor cycle from Sharper Image and loves it. Works really well. So thanks for that suggestion, Diane. And let's see. I think later we'll be posting, you'll be sharing a version of your presentation with links and so on that we'll be posting on the website.
Absolutely.
And we can add links for where people can purchase this equipment. And those of you in the audience, if you have also recommendations of your own, please email them to me and we'll add those to the list as kind of, people's choice.
Absolutely. And just a side note on there, for pretty much a majority of the equipment, so where I talked about the disc, the Velcro pad, and all of those things were, I literally went onto Amazon website just because I wanted to get things that were going to be easily accessible that people could find.
That's great. We really appreciate it. Well, Emily says, thank you, Dr. Stinson. So many great ideas finally geared to us. I can't wait to get a balanced disc, and I want to echo that. Thank you so much. This was an excellent, such a useful presentation.
You are so welcome. I am so glad that I could share with you guys and be a part. So hopefully I will be able to come again another time.
We hope so. And I'll bring back Beth now. And while I step off, and Beth will say a few final words.
Yes, I echo June. What a great presentation. And even for able-bodied people, let's just, things to keep in mind always, right? Just
Absolutely.
Wonderful. Thank you so much. And thank you everyone for attending our webinar today. Very special thank you, obviously, to Dr. Stinson for the excellent presentation and recommendations, and for answering all of our questions too. Thank you, thank you. Our next FSHD University webinar is Thursday, August 19th. It's at the same time, 1 o'clock Eastern. Our speaker is going to be our very own Heloise Hoffman. She's going to share her research work on understanding the relationship between FSHD, sleep, and pain. So please join us next month. Visit our website event calendar for all of the upcoming chapter, wellness, and educational events. There's so many wonderful things coming up, including our signature International Walk and Roll to Cure FSHD fundraiser event in September. So please check the website, join a walk and roll that's closest to you, and be a part of the solution. Again, thank you very much for joining us today, and we'll see you next time. Well, take care, Nikia.
Thank
Very
you
much.
so much.
Thank you so much.
Everybody
Okay.
have a wonderful day.
Bye, everybody.